Well, it is a nerve-wracking, exhilarating moment for medical students nationwide, Match Day, when they find out where they'll spend the next several years training to become doctors. Here in Las Vegas, the stakes are high. As I've told you before, Southern Nevada continues to face one of the most severe physician shortages in the country, making it critical to keep medical talent here locally. And in today's matchup, students at the Kerkorian School of Medicine at UNLV are helping to strengthen that pipeline for us. It's one of the most thrilling days in medical school, finding out where your career takes its next step. But for many in UNLV's class of 2026, the priority wasn't just matching, it was staying right here in Las Vegas.
I am so happy to be staying in Las Vegas. I was born and raised here. It was my #1 choice.
Michelle Perez is headed into psychiatry at UNLV.
I've always wanted to help my community, so I'm super excited to be staying.
Determined to address one of the Valley's most pressing needs.
I think that we need more access to mental health, especially in Las Vegas, and there's so many people that need resources.
She's one of 22 UNLV medical graduates, about 42% of the class staying in Nevada to train at hospitals like UMC, Sunrise, and Mountain View. That's a small increase from last year's 41% and far from the 57% in 2024, the school's highest retention rate.
Have you heard about the significant shortage of diagnostic radiologists here in town, and how did that also influence your decision to want to come here to Las Vegas as well?
Yeah, absolutely. I think there's a shortage of a lot of physicians, but especially radiologists. I think the demand for images just keeps going up, and there's just not enough people that are willing to read them, or just not enough physicians that are radiologists that are willing to read them.
Charlton Bassett says he wants to make a difference here locally, staying at UNLV for diagnostic radiology.
I'm super happy to be here in Las Vegas. I feel like it's a really underserved area. I feel like it could use a lot of help.
Really have a match. And Touro University, Nevada, also strengthening the local pipeline of medical workers with 72 out of 172 students, the majority in primary care, staying in our state. And Sunrise Health System added 114 new residents and fellows this year, joining the 186 already training at Mountain View and Southern Hills Hospital.
So this is my opportunity to be able to pay it forward, and really helping my community has been like a lifelong dream of mine, so I couldn't imagine anything better than this.
And just yesterday, I reported on changes at Boulder City Hospital that could send more patients into Valley facilities. With Southern Nevada already facing a shortage of medical personnel, that overflow could mean longer ER wait times, delayed appointments, and stretched thin specialty care. That is why it's so important to keep more of those graduates here on Match Day, and just to continue to retain that local talent.
It's another reason to keep yourself healthy, right?
Absolutely.
Yeah.
Because listen, doctor times right now, if you try to schedule any appointment with your doctors, it's so difficult. So hopefully, again, we can retain some of those students here.
I just went to an ENT not long ago, and they were booking like 6 months out.
Yeah.
Yeah, it's crazy.
It's tough out